Hello there. If you've just been diagnosed with something called microscopic colitis, I know you've probably got a ton of questions. It can feel really confusing and overwhelming, but you are in exactly the right place. In this explainer, we're going to break down what this condition is, how doctors figure it out, and most importantly, how it's treated, all in a simple, clear way.
For so many people, the whole journey starts right here. You've been struggling with chronic watery diarrhea for what feels like forever. Maybe you've even been told it's just stress or that you have a sensitive stomach. But what if it's actually something more? That's the question that finally leads to answers. And today, we're going to get you those answers.
All right, so here's our plan for today. Think of it as a roadmap. We're going to start with the absolute basics. What is microscopic colitis? Then we'll walk through how you get diagnosed, take a peek at what's happening on a cellular level, look at the potential causes, and then we'll wrap up with your treatment path.
So, first things first, what are we actually talking about here? Well, the name itself, microscopic colitis, gives us our biggest clue. Colitis just means your colon is inflamed, and microscopic, well, that tells you that you can only see this information with a microscope.
And this right here is the central puzzle of the whole condition. You are having very real, very disruptive symptoms, but when a doctor does a colonoscopy and looks inside, your colon, it looks totally normal. I mean, how frustrating is that? But it's actually the classic signpost for this specific disease. The problem is there, it's just invisible to the naked eye.
So the experience of having microscopic colitis, or MC for short, isn't just one thing. Of course, there's the chronic diarrhea, but it often comes with abdominal pain, cramping, a real sense of urgency, sometimes weight loss, and just a deep, draining fatigue. If any of this is sounding familiar, please know you are not alone. These are all well-known features of MC.
Okay, so if the colon looks normal, how on earth do doctors actually confirm you have MC? Let's talk about the diagnosis, because it's a very specific three-step process.
This is basically the official checklist that doctors use. It all starts with your symptoms, that persistent non-bloody diarrhea. Then, step 2 is the colonoscopy, where the doctor confirms that, yep, your colon looks normal on the surface. But step 3 is the absolute key, the biopsy. Taking tiny tissue samples is the only way to get a 100% definitive diagnosis.
And this is a really crucial point. Your doctor can't just take one little sample. A full colonoscopy with multiple biopsies is the gold standard. And here's why. The microscopic inflammation can be patchy. It might not be spread evenly all the way through. So if a doctor only samples one spot, they could miss it entirely. Taking samples from different sections is what gives them the full picture for an accurate diagnosis.
So once those little tissue samples get to the lab, a pathologist puts them under a microscope, and that's when they can identify which of the two types of microscopic colitis you have. Now, your symptoms are going to be the same either way, but what they see in the tissue is totally different. And this breaks it down pretty well. With collagenous colitis, the pathologist sees this thick band of protein called collagen right under the surface lining of your colon. A good way to picture it is like a layer of thick paint has been added where it shouldn't be. On the other hand, with lymphocytic colitis, they see a ton of extra white blood cells, called lymphocytes, that have crowded into that same surface lining. It's kind of like too many security guards all showing up in one small area. Okay, so the big question, what causes this, and who's more likely to get it? Well, the exact cause isn't totally understood yet, but researchers have found some really important clues and risk factors that help us connect the dots.
The data shows a pretty clear pattern. MC usually shows up later in life, with the average age of diagnosis being around 61. It is also way more common in women. And while you don't directly inherit it like you would eye color, it does seem to run in some families, which suggests there might be a genetic link. And this last one is a biggie. Smoking significantly increases your risk for developing either type of MC.
Now, this number is so important, I wanted to put it on its own slide. 40%. That's the percentage of patients with microscopic colitis who also have another autoimmune disorder, things like celiac disease, an autoimmune thyroid issue, or type 1 diabetes. This is a huge clue that suggests a very strong connection to the body's own immune system mistakenly causing this inflammation.
And there's more. Research has also pointed to a link between MC and some very common medications. We're talking about things like NSAIDs for pain, PPIs for acid reflux, and SSRIs for depression. Now, it's really important to say this is a correlation, not a proven cause and effect. But the connection is strong enough that one of the very first things your doctor will do is review your medication list to see if stopping one of these might help.
All right, now for the most important part. What do we do about it?
The treatment. And I have some really good news here. There are highly effective, evidence-based treatments that can manage your symptoms and get you into what's called remission, which just means living symptom-free. So, the treatment path usually begins with a few common-sense steps. First, like we just talked about, your doctor will look at your meds. Simple over-the-counter antidiarrheals can help with the immediate symptoms. And for milder cases, some studies have shown that bismuth salicylate, the active ingredient in things like Pepto-Bismol, can actually be quite effective.
But for most people who have active symptoms, this is the main event, a medication called budesonide. It's a special kind of corticosteroid that's designed to work directly in the bowel, and because of how your body processes it, it has way fewer side effects than other steroids you might have heard of, like prednisone.
And the proof is really in the numbers. This chart comes from a major study, and just look at that difference. Budesonide had a 68% success rate at getting people into remission. Compare that to another common anti-inflammatory, which was only at 26%, and the placebo, which was at 21%. I mean, the data really speaks for itself.
So what about the long run? Well, for a lot of people, the symptoms can try to come back after they stop budesonide. But the good news is, staying on a lower maintenance dose is really effective at keeping people symptom-free. For the very rare cases that are tougher to treat, there are other medications to try. And please hear this, surgery is almost never ever needed for this condition.
We're going to end on what is maybe the single most important and reassuring thing for you to hear. Microscopic colitis, as disruptive and difficult as it can be, is a benign condition. That means it does not increase your risk of getting colorectal cancer. It's a chronic condition, yes, and it needs to be managed, but it is not life-threatening. I really hope this explainer has given you the knowledge and a bit of confidence to move forward on your path to feeling better.